Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot, and we're going to go over alternate type questions. Now, I can't go over all of the alternate type questions. Kahoot just doesn't have that capability, but I do have some fill in the blanks. I have some puzzles. I have some drag and drop or drag and click. So I got a little something in there. Before we get started, I want to say hello and give a special shout out to all the nursing students that I met today over at Nova Southeastern University. You guys were so welcoming to me. The campus was so beautiful, and especially, I cannot remember her name, but the cute blonde that works at the library for the healthcare. Let me tell you something. At Nova Southeastern University, they have a separate library just for the students that are in healthcare. So they've got a library for, the nursing students, the students in the dental program, the students in the medical program, physical therapy. Like they have their own library. And I thought that was so cool. Like I spent my time, I'm such a nerd. I spent a good 45 minutes, maybe even up to, yeah, about 45 minutes just walking down all of the aisles of the library, just looking at all of the books that all had to do with the medical field. I thought that was awesome. And you guys were so kind and welcoming. So as the student that works in that library, because I got lost. Yeah, I got lost. And she helped me find where the nursing students were. Thank you so much. And I'm so happy that I met you. She didn't even know anything about me. So I know you'll be watching my videos from now on. So it was nice meeting you and nice meeting you guys all, meeting you all. Your campus was so beautiful. All right, now back to this Kahoot. It's going to be mixed. We're going to be talking about a little bit about everything, but there's only 9 or 10 slides. So I'll do a part 2 if you guys really want one. I can't guarantee you that it's going to be done before my vacation's up, because remember, I'm not supposed to be, let me tell you something. Every single time that I make a video for you guys during my vacation, I'm going to remind you that I'm on vacation. So yes, I'm doing this, but I'm still going to be ignoring the emails and the private messages because I'm on vacation. I don't exist, right? Okay, great. In the meantime, until I come back officially in September, because I hit the ground running. Until I come back in September, I have lots of content for you, and it's for free. You don't have to pay. Just go to my YouTube channel. I've got videos that are about 30 minutes long. If you want some short learning, go ahead, go to my TikTok. You can go to my Facebook page. I've got TikTok, Instagram, Facebook, and of course, YouTube. My handle's the same everywhere. Nexus Nursing, check it out. For this week alone, just tomorrow, Tuesday, the 30th, and on Thursday, August 1st, I'm doing a next generation NCLEX review. I already did a video about this. I was really upset about the trend that I've been seeing, and I really think it's because it's summertime and you guys are just you being like me, you're in vacation mode, right? But you can't be like me because you're still in school. So you have to be able to focus. I don't understand what's going on. You guys are you're sitting for your boards and the numbers aren't looking good. And I know it's silly mistakes. I know you know better because I've been teaching you. So I know you know better. So I've set up a review part 1, part 2 tomorrow and Thursday. So if you can't make tomorrow, you can sign up for Thursday. Just to remind you how to think like a test writer, how to think critically, remind you the important priority type of patients, the type of delegation patients, the type of patients you're going to put in a room with, who, all that good stuff. That's part 1. And part 2, we actually go over questions, important content that you need to know, important tricks that NCLEX is going to try to use for you to be able to recognize them and not fall for it. So be sure to sign up for part 1 or part 2, either tomorrow, Tuesday, or I don't even think Tuesday's class is open. I think it's booked, it's closed, but you guys can check. Either tomorrow, Tuesday, or Thursday. You can sign up by going to my website, nexusnursinginstitute.com. All right, guys, without any further ado, let's get started. Get started. I hate cutting people off. All right, alternate format questions. Question number 1. Which structure would you expect to be closed by the time the infant is 8 weeks old? And this is a structure, okay? So would it be A, B, C, or D? Which structure would you expect to be closed by the time the infant is 8 weeks old? A is the anterior fontanel, and C is the posterior fontanel. So I just gave you a hint. Wow. Wow, only 23 of you guys chose the correct answer. Okay, so let's make sure you guys get this. By the time the infant is 2 months old, we expect that posterior fontanelle to be closed. Now, when it comes to the anterior fontanelle, we expect that to be closed by about 18 months. Where are the options? It's right there on the screen. No, not 1 year, 18 months, up to 18 months. All right, puzzle, put in order. So your patient who just had a thyroidectomy, they're bleeding out, they're hemorrhaging. In what order are you going to provide care to the patient? Here's your choices. Administer IV fluids, provide reassurance to decrease their anxiety, control their bleeding, maintain a patent airway. So you have to take your mouse and move your options to the correct order. So the first option is going to be your priority. That's what you're going to do first. And your last option is what you're going to do last. Your patient just had a thyroidectomy and they are bleeding out. What is going to be the order of events for your nursing care for that patient? If you were not able to join the Zoom, just go ahead and type in your answer in the comment section. I'll still be able to see your answer. This is completely a priority question. Okay. More of you guys got it wrong than right. So let's talk about this. Whenever you're asked to put your nursing actions in order, what you're really being asked is to prioritize what is most important. And I said this to you guys a million times. Whenever you're thinking of prioritization, what you should be thinking of what's going to kill your patient the fastest, so because that's what you're going to have to stop, or what's going to keep your patient alive the longest. That's what you're going to have to do. So when it comes to priority, what's most important? Maintaining that patient airway. Why? Nothing else matters if your patient isn't bleeding, right? It doesn't matter if you control their bleeding. It doesn't matter if you give them IV fluids. It doesn't matter if you decrease their anxiety if they're dead, right? So the first thing you always want to do is make sure your patient's alive. Make sure there's oxygen going into their body. There's perfusion happening. So you're going to maintain the patent airway. Now, why is this important? I want you to think about it. Where did this patient just had surgery? They just had a thyroidectomy. Whenever something ends in the word ectomy, that means removal of. Thyroidectomy, removal of the thyroid. Where's the thyroid gland? Right here. In your throat where your airway is. Okay? Patient just had surgery right here. That is very traumatic. What can happen? Swelling. Their airway can close up. So the very first thing you're going to do is maintain patent airway. And not only can swelling occlude the airway, it just said that the patient had a thyroidectomy and they're hemorrhaging. Where do you think they're hemorrhaging? They're hemorrhaging where they just had the surgery. Duh. So not only are they at risk for swelling of the area that can obstruct the airway, they're bleeding. That bleeding, of course, can obstruct the airway. The first thing we're going to do is maintain patent airway. The next thing we're going to do, I'm so sorry. If you are new to my channel, I'm yelling at you, but it's with love. I promise. I'm saying everything with love. I'm not being mean. Okay. Okay. The next thing you're going to do is control the bleeding. All right, Professor D, how do I know that bleeding comes second? Again, our priority is to make sure our patient's alive. That's our number one priority. After we make sure that they're alive, they're breathing, what's going to be our next priority? Hemodynamic status, duh. Because guess what? If their hemodynamic status is compromised, their organs are going to fail. If their organs fail, they're not going to live long. They're going to eventually stop breathing. So your first priority is going to be breathing, right? And after that is hemodynamic status. We got to make sure they're not bleeding out. We don't want that patient to go into shock. So that's the second thing we're going to do. All right, Professor D, I made sure my patient's breathing. I made sure I helped them stop bleeding out. I fixed that, controlled that hemodynamic status. What's the next thing? Fluid and electrolytes. Why? Because fluid and electrolytes is not going to come before airway. It's not more important than airway. And it's not going to come before bleeding, but it'll come right after, right? Because without fluid and electrolytes, what else can happen? Your body can go into shock. Your body can shut down. But what can cause your body to shut down faster? Bleeding or lack of IV fluids? The bleeding. That's why bleeding comes first, because before the lack of IV fluids. So now we replace the IV fluids, and last are the patient's emotions, including anxiety. When there's an emergency situation, I'm telling you right now, the patient's feelings, their thoughts, teaching them, educating them, reassuring them, that is last. We don't care about any of that if their life is in danger. Now, with that being said, before I move on to my next screen, let's talk about priority. What type of things automatically is going to go into our list of priorities? So if we see these things, we know it's going to be a priority if it's an issue. Airway, breathing, circulation, hemodynamic status such as bleeding, fluid and electrolytes, especially sodium and potassium. What else? Glucose. Blood sugar is supposed to be 7110. Especially if that patient's hypoglycemic. Why? Low blood glucose will kill you a lot faster than high blood glucose, right? The patient can live a lot longer because if their glucose is too high, they're hyperglycemic, we start seeing polyuria, polyphagia, polydipsia. Body's doing all of these different things to compensate. But if that blood sugar is too low, boom, your patient's on the ground. They're unconscious, right? So hypoglycemia. What else falls under priority? Excessive, oh my gosh, I got vacation brain. I need to get together. Excessive diarrhea, excessive vomiting. Why? If you have excessive diarrhea, you're losing fluid and electrolytes out your butt. Base comes out the butt. If you have excessive vomiting, you're losing fluid and electrolytes, but it's going the other way. Okay, it's coming up instead of down, but you're still losing fluid and electrolytes. That can cause dehydration. By the way, dehydration also falls under priority, because the patient gets dehydrated enough, they're losing fluid and electrolytes, their organs start to shut down. Any patient that's exhibiting signs or symptoms of a myocardial infarction, that's going to be a priority patient. Any patient seizure, that's going to be a priority patient. So guys, you really have to make sure you understand what type of patients take priority and what your nursing interventions are going to be for those type of patients. How are you guys doing on the live? Okay, AK said burns. I'm happy you asked that, AK. Yes and no, it depends. It depends. Nursing is not cookie cutter, right? You have to use your critical thinking. So if the patient has a burn, they were known to be, there was a fire in a closed space, which means they probably breathed in those noxious gases. Yes, that's going to be a priority patient. Why? Their airway can close up. That's going to make them a priority patient. Or patient had burns and we see soot right here under their nose. That lets us know what? They breathed in the noxious agents. Or we'll see that their eyebrows were burned off. Guess what? They were that close. They breathed in those noxious agents, right? Their airway can close up. That's going to be a priority patient. But what if it's a patient that had a burn on their pinky? You got a burn on your pinky. I mean, I'm not happy you got a burn on your pinky, but is that going to put your life at risk? No. But if it's a severe burn where all of the blood, the fluid, the electrolytes, everything that's supposed to be in the vascular space has shifted. That burn was so severe, now the fluid has shifted, and now this patient's all what? Swollen, but they're dehydrated. That patient's going to be a priority. So when it comes to burn, it really depends on the clinical situation. Thank you for asking. Whenever the patient's, again, this brings me back to priority. Whenever the patient's hemodynamic status is at risk, hemodynamic, all of the blood shifting from the vascular space to the tissues, or whenever their respiratory status, ABCs, respiratory status, is in trouble, that's going to be a priority patient. Okay? Okay, let's keep going. All right, pin your answer. So you're going to click on the correct space, okay? Your patient has Hirschsprung's disease. Where would you expect to note the abnormality? Oh, I thought this picture was going to be much bigger. I'm sorry. All right, so the picture on top, where would you expect the abnormality to be noted? So take your mouse and click where you would expect the abnormality to be noted in the patient with Hirschsprung's disease. Now, while you're thinking of your answer, I'll just remind you that patient with Hirschsprung's disease, this is going to be a newborn. Hirschsprung's disease is also known as aganglionic megacolon. Okay. And so what happens is they're supposed to have these gangliotic cells that make the intestine, the muscles in the intestines contract like this so fecal matter can move. But this type of patient is missing those ganglionic cells, or they don't have enough of those ganglionic cells. You guys have got to be kidding me. Okay, let's talk about this. This area right here, where you see like the rectum, the rectum and the anus, this is where you're most likely to see it. Now, this can happen anywhere in the large intestine, but where you are most likely to see it is around the rectal area. And so what happens, because those ganglionic cells are missing, those muscles that are, look at my hands, supposed to contract like this, right? In the large intestine, it's not contracting like it's supposed to. And so what are we not seeing? Peristalsis. What happens to fecal matter that's not moving? That fecal matter is not moving, so the patient's not having a bowel movement. This is a newborn. So that newborn is continuously being fed. It's going in, but nothing's coming out. So that's why this newborn, we're going to see them irritated. We're going to see them with that abdominal distension because that fecal matter is building up. They're going to have a vomiting, right? So you, by the way, you should suspect Hirschsprung's in the newborn if they haven't had their first bowel movement within that first 48 hours, because guess what? They've been doing all this feeding. How's everything going in, but nothing's coming out? You should suspect Hirschsprung's disease, and you should notify a healthcare provider that there's been no bowel movement yet. So anyway, even though it can happen anywhere in the large intestine, predominantly you're going to see it around, you know, the rectum and the anus. Okay. Any questions on the live? OMG, you helped me get through nursing skills. I love your content. Thank you. You're welcome, Missy Ryan, Missy Rianne. You're welcome. I'm happy I can help. Okay, next question. Type in your answer. You're ordered to administer dexamethasone 0.9 milligrams. The solution in your hand is 0.6 milligrams per 5 mLs. How many mLs are you going to give? Type in your answer. So go ahead, guys. Pull out your paper and pen. And I know the nursing programs these days, you're allowed to use your calculator. So go ahead, use your calculator if you need to. If you're old school like me, paper and pen, go ahead, do the math. Tell me how many mLs are you going to give your patient? The order is to give 0.9 milligrams of dexamethasone. By the way, dexamethasone is steroid. Is to give 0.9 milligrams, but what's available is 0.6 milligrams over 5 mLs. Now we're going to go over the answer, and I'm going to tell you how I did the math. But again, guys, there's a million ways to skin a cat. There's different ways to do the math. The way I do my math is old school. If it doesn't work for you, don't listen to me. Just stick to what you know. If it works for you, great. I have lots of nursing math videos in my pharmacology playlist. So if you want to practice some more and actually watch me do the math, go to my YouTube after this. Oh, no, ma'am. I know you're lying. Hold on. Oh, okay. I thought it said 0. Like nobody got the answer correct. Okay, good. 53. More than half of you guys got the correct answer. 7.5 ml. 200? Oh, you guys are out here killing patients. You guys are murderers. That's right. Order times ml over supply. That absolutely is one way to do it. Very good. I do it another way, but you're absolutely right. Yes, Croatia. That's how I do my math. I'm about to explain to them. So here's how I do my math. Again, if you don't like it, don't listen to me. Just do it the way that you like. Here's how I do my math. You see how I told you what you have right here and what's ordered? What you have is always going to look like this. It's going to be your milligram or whatever your unit is over something else. Keep it. You see how it's together? 0.6 milligram over 5 mLs. You keep that together. So on a piece of paper, I'm literally going to write 0.6 milligrams over 5 mLs equals. And on the next side, all I have left is 0.9 milligrams. Is my 0.9 milligrams going to go on the top or on the bottom? It's going to go on the top because everything has to match. 0.6 milligrams is on the top, 0.9 milligrams is on the top. So I'm going to have 0.6 over 5 milliliters equals 0.9 over X. Why X? X is what we're solving, X ml. You see how 5 ml is on the bottom? X ml is going to be on the bottom. So we're going to have 0.6 milligrams over 5 mLs equals 0.9 milligrams over X ml. And when we do that, hold on, let me do the nursing math real quick. 0.9 milligrams over X ml times 0.6 milligrams over 5 ml. Now I'm going to cross multiply. I'm going to have 0.6x is equal to 0.9 times 5. Hold on. 0.9 times 5, 5, 45, 0, 4. Okay, so that gives me 4.5. So now I have 0.6x equals 4.5. But I'm not done because I got to get x by itself. 0.6x equals 4.5. How do I get x by itself? I divide by both sides. 0.6 divide by 0.6. 4.5 divide by 0.6. 0.6 goes into 4.5. 7.5 times. So we're going to give 7.5 mLs. You're the reason why I understand med-surg. I'm so happy I could help. Make sure you guys practice your dosage calculations. I've got lots of videos to help you. This is kind of confusing because you can't see me do the math, but I've got lots of videos on my YouTube channel, okay? Go there and watch them if you need help on dosage calculations. All right, let's move on. All right, pin answer. So you're going to point and click. Your patient is diagnosed with right-sided pneumonia. Where would you place your stethoscope to confirm full oxygenation? You want to make sure that your patient's being fully oxygenated. Where are you going to place your stethoscope? Again, they're diagnosed with right-sided pneumonia. Go ahead, take your mouse and click to the area where you would place your stethoscope if you wanted to confirm that the patient was being fully oxygenated. Very good, Carry On. I see you. Okay. Let me see if I can move this out the way. Oh, I can't move these out the way. But guys, this area right here, why? Because that's the bottom of the right lung. Remember, your patient's left side is your right and the patient's right side is your left. So if I tell you the patient has right-sided pneumonia, right? You're gonna put your stethoscope over here. For you, it's your left side, but this is the patient's right side. Remember, they're facing you. So you're gonna put your stethoscope in the right lower lobe. Why are we placing the stethoscope in the right lower lobe at the very bottom portion of the right lung? Here's why. If you want to see if that patient's being fully oxygenated, you're going to put your stethoscope on the very bottom, because remember, air goes in through the nose and the mouth. If you want to know if they're fully oxygenated, you want the air to go all the way to the bottom of that lung. You want, as that patient is inhaling and exhaling, you want to hear if that patient, if the oxygen's moving. You want to hear if they're being oxygenated. And the only way you'll know that they're being fully oxygenated is if you put that stethoscope at the bottom lobe of the lung to hear for oxygen moving when the patient's inhaling and exhaling. Okay? You guys are laughing at me? All right. Type in your answer. Which acid-base balance is your patient experiencing? So the pH is 7.21, the CO2 is 35, and the bicarb is 15. Which acid-base balance is your patient experiencing? Type in your answer. And I'm going to give you a hint. Well, not a hint, but I'll give you choices. It's going to be respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis. So don't type anything else. It's going to be one of those four. pH is 7.21, CO2 is 35, and the bicarb, HCO3, is 15. What is your patient experiencing? While you guys are thinking about this, so let me tell you something. When you guys get these type of questions, you're going to get way more information about the patient. We don't care. All of that other information they give you about the patient, they're just extras. Okay? It's just fluff. It may be helpful. Maybe, they may mention the patient's vomiting or the patient's coughing, whatever, but all that's extra. All you need to truly answer your question is the pH, the CO2, and the bicarb. That is it. Let's see how many. 50. Very good. Okay. More than half of you guys got the correct answer. Metabolic acidosis. Professor D, how did we come to this conclusion? I'm so happy you asked. Let me answer that question for you. The name of the game is your pH. Everything that your lungs do, CO2, everything that your kidneys do, HCO3, is to get your pH within the normal parameters of 7.35 to 7.45. That is the normal parameter. If you ever get a question asking you if your patient's fully compensated, if the pH is within 7.35 to 7.45, it's between these two, the patient's fully compensated. That is the name of the game. Everything that your lungs are doing, everything that your kidneys are doing is to get your pH between 7.35 and 7.45. Anything less than 7.35, the patient's acidic. Anything higher than 7.45, the patient is alkalinic or basic. Look at our patient's pH. If we look at our patient's pH right here, it says 7.21. Well, 7.21 is lower than 7.35. That's how we know our patient's in acidosis. The pH is always going to tell you if the patient's in acidosis, if the patient's in alkalosis, or if the patient's fully compensated, which means they're within the normal parameters of 7.35 to 7.45. So because this patient 7.21 is lower than 7.35, we know that the patient is in acidosis. They're in an acidotic state. Now we got to figure out, is it metabolic or is it respiratory? Remember, if it's metabolic, the kidneys are in trouble. And if it's respiratory, the lungs are in trouble. So let's look at our other numbers. CO2 is 35. Well, guys, whenever you think of CO2, you need to be thinking of the lungs, because it's the lungs that make you exhale CO2. What is our normal CO2 level? What is it? 35 to 45. That is your normal CO2 level. 35 to 45. Well, this patient's CO2 is 35. That's within the normal parameters. So guess what? The lungs aren't the ones that's in trouble. because CO2 represents lungs and the lungs are normal. Lungs, CO2 35 to 45. So it can be respiratory acidosis. We've already established that the patient's in the acidotic state. We just don't know if it's respiratory and metabolic. But we know that CO2, the lungs are responsible for CO2 and CO2 is normal. So it can't be respiratory. It can't be the lungs. All we have left are the kidneys, bicarb, HCO3. The kidneys are responsible for HCO3. They're responsible for bicarb. Bicarb within itself, it's basic. Okay. When you think of bicarb, I want you to think of metabolic. HCO3 is 15. Well, what's the normal HCO3 or bicarb level? Normal is 22 to 28. So the bicarb level is abnormal, which means the kidneys are abnormal, which means it's what? Metabolic. So the patient is in metabolic acidosis. Do you see how I did that? Now, there's another way you can do it. If you don't like this method, you can use a tic-tac-toe method. It will be too hard for me just to explain it without showing you, but I have a video where I do several of the tic-tac-toe method. If you prefer the tic-tac-toe method and you want to practice with me, go to my Fundamentals of Nursing playlist, and I have lots of videos on acid base, and I do the tic-tac-toe method, and I do this method, okay? How are you guys doing on my live? Did I lose you, or you're still with me? How many days a week do you go? I'm on vacation. I'm not even here. So it's not scheduled. I'm just, yeah. It's never scheduled. It's never scheduled. Type your answer. Okay, let me move this. You have to give 500 milliliters of an IV fluid over 12 hours via microdrip tubing, which is 60 drops per ml. How many drops per minute are you going to deliver? Let me move this. So you have to give 500 mLs of a solution via microdrop tubing for 12 hours. The delivery is going to have to be over 12 hours. How many drops per minute are we going to give? Type in your answer. Your answer should be a number. How many drops per minute are we going to give if we have to give a patient 500 milliliters at 60 drops per milliliter over a 12-hour time span? Okay, Brittany, Isis, Winnie Brown. Very good. I see you guys. Wow, only 29 of you guys got this correct. Let's talk about this. Let me tell you something. The question looks way harder than it really is. I'm going to tell you the formula to figure out drops per minute. It's so easy, I promise. Take a second, grab your pen or pencil and paper, because I want you to write this formula down so you don't ever forget it. You guys ready? All right. Here's how you always, every single time, you figure out your drops per minute. Your formula is volume, however much you have to give. In our case, it's 500. We're giving 500 mLs. You may have to give 200 mLs. You may have to give 300 mLs, whatever your volume is. Your formula is volume times your drip factor. Our drip factor here is 60 drops per minute. Volume times drip factor all over time in minutes. So you're going to do 500 times 60 all over your time in minutes, which is 12 hours. But remember, I said your time has to be in what? In minutes. So you can't just have 500 times 60 over 12. You're not going to get the right answer. It has to be 500 times 60 over 12 times 60. Why? It's 12 hours. But it has to be time in minutes. So 12, and there's 60 minutes in an hour, obviously. So it's going to be 12 times 60. Let's say this question said you had to deliver 500 milliliters. Your drip factor was still 60, but your time changed. Let's say your time was 5. How would you set it up? You set it up 500 times 60 all over 5 times 60. All right. Whatever your hours times 60. All right, Professor D, what if they don't give it to me in hours? What if they give it to me in minutes? That's even easier for you because remember, your formula is volume times drop factor all over time in minutes. So if they tell you 45 minutes, it's going to be this 500 times your 60 all over 45. If they tell you 20 minutes, it's going to be your 500 times your 60 all over 20. If they tell you 30 minutes, it's going to be your 500 times your 60 all over 30. Okay? If they give you the time in hours, you're going to multiply that time times 60. But if they give it to you in minutes, you're good to go. You're going to have your volume times your drop factor on top all over your time in minutes. Anyway, let's do this math, guys. We have 500 times 60 all over 12 times 60. All right, 500 times 60. Hold on, 5 times 6 is 30. Let me add my zeros. 1, 2, 3. 1, 2, 3. Okay, so 500 times 60, that gives me 30,000 all over 12 times 60. 12 times 6. I don't know what that is. No. Yeah, 12 times 60. Add my zero. Okay, 720. So we have 30,000 all over 720. But we're not done. We got to keep going. How many times does 720 go into 30,000? $41.6. Let me ask you something. Can you give 41.6 of a drop? No. A drop is like a raindrop, right? It's going to be a whole number. You have 1 raindrop, you have 2 raindrops, you have 3 raindrops, you have 4 raindrops. You don't have half a raindrop. How are you going to give half of a drop? That makes no sense. So that 41.6 has to be rounded up to 42. That's how we got to 42 drops per minute. You don't ever have a partial of a drop. You ever have a part like a point something, you better round up or down. Okay? All right. So this is your patient. Which diagnosis would you expect to find in that patient's chart? This is what your patient looks like. Take a good look at this patient. What's wrong with them? What diagnosis would you expect to find in that patient's chart? Would it be hyperthyroidism? Would it be Cushing's disease? Would it be COPD? Or would it be Parkinson's disease? What do you think? Very good. There's over 100 people on this Kahoot. Why is only 56 answering? Come on, guys. This was an easy one. COPD. This patient either has, they either have like emphysema or bronchitis. They've got a barrel chest. They're holding on to all of that CO2. Instead of breathing out, they're holding on to it. That's why they've got that barrel chest. They're going to be highly what? Acidic. When you think of CO2, when you think of carbon dioxide, think to yourself carbon diacid because CO2 is acidic. That patient's got a barrel chest. You're going to be thinking of carbon dioxide, barrel chest, CO2, COPD. Now, let's talk about the other options before we move on. Hyperthyroidism. That patient with hyperthyroidism, maybe I'd put a picture of a goiter, right? Or exophthalmos, their eyes bugging out. Patient may have hypertension. They may have diarrhea. They may have increased heart rate. Everything is up. That's your hyperthyroidism patient. Cushing's disease. With Cushing's disease, patients got way too much cortisol. This patient would have like the moon face. They would have the buffalo hump. They would have the purple striae. Their skin would be very thin. They'd be at risk for fractures. They would have very large abdominal girth, but very thin extremities. That would be your patient with Cushing's disease. And Parkinson's disease. Remember Parkinson's disease, that's a patient who has a lack of what? Dopamine, right? The patient with Parkinson's disease would have the TRAP symptoms, T-R-A-P. They'd have the tremors even at rest. Their hands would be like this, right? They'd have the rigidity. They'd have akinesia. They'd have postural instability. They'd be at risk for falls. But the patient with the barrel chest, we're thinking again, either, bronchitis or emphysema. We're thinking COPD with that barrel chest. Thank you. Fitness trainer, Miss Ray's, pin rolling. Yes. Patient with Parkinson's disease, you'd see pin rolling. Yes, that's another symptom of Parkinson's disease. Very good. All right, your patient tells you that she's on, I can't pronounce, guys, medroxyprogesterone for contraception. You teach her to increase an intake of what? Folic acid, vitamin B12, calcium, or potassium. My picture is not showing up, but you don't need the picture to figure this out. The patient is getting medroxyprogesterone for contraception. What are you going to tell that patient to increase their intake of? Folic acid, vitamin B12, calcium, or potassium? You guys are really doing the most. For the 20 of you that chose folic acid, let's think about this. I want us to think critically, and I'm holding your hand while I say this because I'm your friend, right? I'm not yelling at you. I'm not mean. If I just told you that the patient's taking, I can't, medroxyprogesterone, you may not know that medication. That's okay. But I followed that up with for contraception, which means that they don't want to get pregnant. Why would they be taking folic acid? Folic acid is to prevent neural tube defects in a growing fetus. Right? Okay. So no, folic acid is not the correct answer. Vitamin B12, as much as we love vitamin B12, it's good for the patient's neurological status. That's not the answer. Matter of fact, if I tell you medroxyprogesterone, what it is, maybe it'll help. Because I told you it's for contraception, but let me be a little bit more specific. It's Depo-Vera. Patients getting Depo. They're getting that injection every 3 months or whatever. Does that help? It's going to be calcium. What we know about this type of drug is that, well, we know a couple things about this type of drug, but one of the most important things is that this patient is going to be at risk for blood clots. We're going to be careful about that. We're going to warn them about those signs and symptoms to report. But a big concern is that this medication increases the risk of osteoporosis. So we have to teach the patient that, first of all, they can't be taking this drug long term. Like they can't be on it for years and years and years and years. Okay. You're going to mess around and get osteoporosis. So we're going to teach them that they can't be on it long-term chronically, number one. Number two, we're going to teach them that for, the short time that they're on it, they may be on it for a year. We're going to teach them that they need to be taking calcium and vitamins. Why? Calcium is important for making the bone strong, but what's the point of taking all this calcium if your body's not absorbing it? You need vitamin D to absorb calcium. So that's why they're going to take calcium supplements along with vitamin D. So they're taking the calcium to make the bone stronger because we don't want fractures, but they're taking the vitamin D so that the body can actually absorb the calcium, okay? How many questions is this Kahoot? I'm sorry, we're almost done. It's 11 questions and we're on the 9th one. Hang in there. Hang in there. All right, 10. 10 out of 11. You're teaching deep breathing exercises to your patient that just had abdominal surgery. What's going to be the correct order of teaching them? Deep breathing exercises. Here's our choices. Cough deeply from the lungs, split the incisional area, breathe out through pursed lips, breathe in through the nose. So take your mouse and put in the correct order. How are you going to teach your patient who just had abdominal surgery to breathe deeply? Go ahead and put it in order. Take your mouse and put it in the correct order. Did I make this Kahoot too long? Okay. Only 29 of you guys got it right. So let's talk about this. any patient that comes out of surgery, it does not matter what type of surgery they had. It doesn't matter. If they had surgery, they had an invasive procedure, your top three concerns. Always. It doesn't matter if it's abdominal surgery, an amputation, a thyroidectomy. It does not matter. If they had an invasive procedure, we're going to be concerned about infection. We're going to be concerned about a DVT or a pulmonary embolism. By the way, pulmonary embolism is worse than a DVT. And we're going to be concerned about that patient bleeding to death, bleeding out, internal hemorrhage. Okay? All right, let me get that out the way. Just make sure you know that. Whenever you get a test question, they tell you patient just had surgery, have that in the back of your mind because 80% of the time, that's where the test writer is going with. They want to see if you understand what the priority for that patient is. Now, back to this question. This patient just had abdominal surgery. We want them to deep breathe. Guess what? They just had abdominal surgery. It hurts. We're going to tell them to deep breathe. They're going to pretend like they're breathing deep, but they're really not going to do it because it hurts. So if we want them to truly deep breathe the way we teaching them to, the very first thing you're going to teach them to do is splint that incisional site. The splint that's given to the patient or the pillow, whatever is given to the patient to press against that site or apply that pressure, it's going to help decrease the pain so they actually do breathe deeply. Because here's a problem. Remember how I told you any patient had surgery, we're concerned about three things: infection, DVT, pulmonary embolism, or hemorrhage. When I say infection, one of the biggest infections is pneumonia. They just had surgery, and because it was so painful, they weren't breathing deeply the way that they were supposed to. Nothing was moving, and they got infections such as pneumonia. We're trying to avoid that from happening. So we need them to breathe deeply. So the first thing we're going to do is teach them to splint the incisional site. It's going to help decrease pain so that they can breathe deeper. After that, we want them to take a deep breath in through the nose, then breathe out through pursed lips. Why? So all of that CO2 is not going out at once. We want to what? Strengthen the diaphragm, strengthen those respiratory muscles. Then they're going to cough deeply from the lungs because guess what? We don't want the crap that's in the mouth. We want the crap that's deep down in the lungs. So we want them coughing deeply from the lungs. Okay? And guys, here's the thing. What I'm teaching you, you cannot memorize it. Make sure you that's why I'm taking the time. I'm not just going through answers. I'm explaining to you why the answer is the answer. If you understand why, you understand the pathophysiology of what's happening, no matter how the question's twisted to you, you're going to get the answer correct because you understand. You didn't just try to memorize. All right. Down to our last question. You're welcome. All right. Tiffany said, so why wouldn't you cough first to get it up? Tiffany, if it hurts to even breathe, you think that patient's going to cough deep from the lungs? It hurts them to even breathe. It hurts them to even take a breath in. That's why we're splinting first. So why in the world would we have that patient cough deeply from the lungs? You want to know what that patient's going to do? They're going to do this. And then you're going to get frustrated. Right? So that's why we're going to have them splint that area first. We want them to take a deep breath so they have that force. When they're coughing out, oh, baby, they're coughing out. They got something to cough out because they already took the deep breath. I hope that makes sense. She's on vacation and she's still helping. I'm telling you, like 2 weeks into my vacation, I started missing you guys. I started getting antsy. Of course, we don't want wound dehiscence. That's a whole, I should have done another slide on wound dehiscence. That's right. All right, type in your answer. Last question. You're doing a neurological assessment on your patient. They can open their eyes spontaneously. They can follow commands, and they're oriented to person, place, and time. What is their Glasgow Coma Scale? Type in your answer. I'll give you a hint. It's a number. I'm on a Kahoot. What's up? Okay, I'm on my last question. Thank you. Love you. Okay, good. 54 of you guys chose 15. Very, very good. So what we look for is like the eye opening, the motor response, and the verbal response. And the patient did perfect on all three, right? 15. 15 is the best that you can do, by the way. And 3 is the worst that you can do. All right, let's see how you guys did. I got to get going. I got to get back to the Airbnb. All right, let's see how you guys did.